Last Friday, medical intern students in the whole country gave the health ministry until Monday to pay their allowances, or else they lay down their tools. Well, it seems government did not heed to their call and the strike is on. At Gulu Regional Referral Hospital, patients were stranded in queues with few medical personnel to attend to them, but the hospital has 45 interns practicing at the referral hospital.
For instance, as I speak now, in surgical ward, we have about 62 patients. And out of the 62 clients to be served, we have only one medical officer or one doctor. The same applies to the pediatric department, where we have about 42 clients and one medical officer. So this is really a gap and a challenge to the hospital.
At Fort Portal Regional Hospital, interns are only attending to emergencies. The 47 interns currently say they cannot afford to pay rent, transport and feeding due to the insufficient pay from government. The hospital currently receives more than 300 patients.
Many regional referrals and national referrals don't offer accommodation to interns. Even those that offer that accommodation, a few interns are catered for in those messes, the so-called interns messes. So
the interns at Mbara Referral Hospital were seen enjoying a drink at the doctor's mess. Leaders of interns in both the Uganda Medical Interns Association and the Federation for Medical Interns agree that the strike is still on until the government pays them.
But in the event that we don't have what to eat, we cannot afford livelihood, we cannot be in the hospitals, because at the end of the day, you're going to see intern doctors, intern pharmacists extorting money from patients. And then we compromise professionalism.
But when ministry refuses to respond, they don't give you a statement, they just keep quiet. They don't, what do you expect to tell your colleagues? For example, for us leaders, people will be asking you, where is our money? You don't have what to tell them. They ask you for a full month, you go for a second month, they have not released the money.
At the moment, only emergencies will be handled by the interns at the different health facilities.
Because you can't let patients die who come in emergency situations. But once stable, then you can let them be.
Those accident victims, patients who come with intestinal obstruction, children who are convulsing, we are going to work on them. However, these other services, we are saying we cannot continue working without having what to eat.
However, the strike comes at a time when the country is trying everything possible to contain the spread of the Ebola virus, which has claimed more than 40 lives in the country.
So you want us also to get Ebola, because Ebola will find us when we are frustrated, mentally and physically. We shall not be in position to put on PPEs. We shall just go and serve.
So I should as well protect myself before I protect the other person. Because if I die, then the whole essence of protecting the other also loses meaning.
Asked about this, Health Ministry spokesperson Emmanuel Inebiona says the required monies have been sent to the accounts of the different hospitals for onward dispatch to the interns.
The funds will reflect on their respective accounts during this week. So it is really not called for at this time.
Aside from this, the interns have on many occasions asked the Ministry of Health to honor the President's directive to pay them half of what their seniors get, but this has not happened for the several months.
As you saw, their allowances are a bit better now compared like it was. So it is something that is done progressively. There are always challenges, and at any time government solves those challenges.
Raymond Tamale, NTV.